Hello, everyone. Welcome to the Podium series of Global Summit. I was here yesterday with Dr. Dennis Smiley, and today I'm with Dr. Hanna Mansoor from the United States also. So welcome wherever you are in the world. Probably in some places will be good morning, some places will be good afternoon, some places will be good night. And today we are going to have the lovely and the diva in dentistry from the United States, Dr. Hanna, that will be talking about lasers in dentistry and how to use lasers in your practice and to improve your practice. So I'm going to present a little bit Dr. Hanna, read a little bit her bio, her CV, and then we'll have some questions. I'm going to make some questions so you can know her a little bit better, not only professionally, but as a person, and then she will present the topic that is lasers in dentistry. At the end, we will have the question and answer session. So Dr. Hanna Mansoor, that I had the pleasure to meet personally already more than one time, graduated from the Detroit Mercy School of Dentistry and went to start from scratch practice in 2008. Since then, Dr. Mansoor has used her creativity and passion for dentistry to build a state-of-the-art practice, branding and elegance and of elevated clinical dentistry called Smiles by Hanna. She's a master clinician in implant placement, in cosmetics, in advanced endodontics, in periodontotherapy, and in laser dentistry, and won the third place for her stem cells in series presentation at the ICOI. With the heart to teach as a dental assistant in school since 2013, as well as provides advanced clinical training for dentists nationwide. I know her quite well. We were together, I think 1 year and so ago in Brazil, and she's very passionate, very about surgery, and I know she's a very talented surgeon. Today we are going to see some also other aspects of her. And I would like to start to ask you, Anna, because people would like to know you a little bit better. How did you start your practice? It was easy, it was difficult. Do you have a private practice that is your own? Do you have an associated partner? How do you do your normal work daily?
Thank you, Raquel, for the introduction. And thank you for all the listeners out there. I hope you guys hear us out till the end, and hopefully you'll get something out of my presentation. First I moved from Michigan, where I grew up, and I moved to Arizona in 2007, just when the recession happened. And I worked for a corporate group for about 8 months. At that time, I felt like this is not how I want to do dentistry. I want to do more slow dentistry. I want to, pick and choose my patients. So I started saving some money. I had $25,000, and I thought, you know what, with God on my side, and just keep looking until I find a place that I fall in love with, and I did. And so there was a lot of dentists in 2007 selling their practices and filing bankruptcy. So I landed on the one that I own now. It was open 3 years, and the doctor was about to file bankruptcy. So I purchased the practice quickly with just my down payment of $25,000. And I just put my faith in God, and I said, this is what I have to do. And I know I have to work hard. At the time, the banks gave me 5 years to pay the entire thing off. So you can imagine me working with really not a lot of patients. And just like paying the overhead expense, the lease, plus the bank loan, and just my staff. So for 6 months, I worked and really never paid myself. So at the time, I thought, okay, what can I do to make a difference? Initially, my fear was, am I going to make it? How am I going to make all these payments? But like I said, it just happened. So I worked hard, patients started coming, we got a lot more referrals, internal marketing, and just did some outside marketing, and it just worked.
Yeah, and I know you're doing a good job and being successful. And I will ask also, because you also have professional and private life, and sometimes it's not so easy to balance everything. So regarding being a woman dentist, a surgeon, entrepreneur, because you also invested a lot, how can you grow and be noticed? Because in some situations, we are still searching for equality of opportunities. And we are talking as women surgeons, namely because it's one area that is mostly connected to men. But
Yes.
things are changing. So what do you think you made different to be different and to be recognized?
To be honest, like to be equal in a world, like you said, of mostly men surgeons, I do struggle with that. But my main thing is to continue to be respectful. As sometimes, we post things, we are somewhat ridiculed, somewhat, or they think, oh, maybe she's not capable. She's not an oral surgeon. She's not this and that. Well, to be honest, I feel that I should prove myself. Otherwise, the only way I can do that is by continuing to improve myself with my education, right? So the more I educate myself, the more I invest and continue education. I mean, I think I'm so passionate about surgery. I found my passion 10 years ago, and I just kept growing and growing. I spend, a lot of money per year. I take about 200 to 300 CEs per year, so that when someone does make a comment, I know how to intelligently answer them. And I think you have to prove yourself as a good surgeon. You have to also show quality type of work if you really want to be equal to another person, right? So I don't think it's about whether you're a man or a woman. It's more about the quality of clinician you are, right? Because we've seen women that want to be speakers, but really they don't have what it takes. So you have to invest in yourself. You have to continuously learn. You have to invest in the top of the line products to get there, and the high tech equipment. You just have to keep learning and never stop learning.
Yeah, totally agree. And did you struggle to have the balance between the personal life, the family life, and the professional life? Because many times I do lectures in many countries, and most of the times the ladies are asking me, how do you manage, to balance? And I say it's not easy when you have children, and you have a husband, when it's divorced and you're remarried again. It's life, and you have problems, and sometimes it's very, very difficult to balance everything. But what I always transmit is that is possible. And if you are very passionate about your work and very focused, like you are, that I know you are, and you pursue a certain path, and with time you will make it for, because you are very centered in that. So did you find also these kind of struggles between balancing?
Absolutely. I mean, you have to have supporting family, right? Your husband, your significant other, your children have to understand and believe in your passion. That's number one. Because if they don't, they're not going to be supportive, and it's going to be a struggle. It's going to be a war. Also, you have to set times. I have to set up times where I tell my family that, hey, I need this weekend to prepare for my seminar, or I need this to study, or I need this to listen to all these videos. When I was doing my mastership in implantology with guys, we had to listen to 300 hours of videos. You can imagine. I have to work full time, come home, eat, and then it's like going back to school. So it was a lot of hard work. And with anything, they have to be very supportive, and they have to respect that this is your passion. And at the end of the day, you have to make up time for them as well. You gotta plan little trips here and there, weekends, maybe say, okay, this weekend's for me, the next one's for you guys. But I think it has to be all in agreement.
Yeah, totally right. And I also felt this because at the time I did my official education almost in step by step after I graduated. But then I stopped for a while. I had children, I married, I had practices. And then a few years later, I returned to do the PhD, and it was a nightmare because I was not used anymore to have the balance between working and studying and all this stuff.
It's so hard.
And you really need someone to be behind you and to support. And even your children, even if they are small, they have to understand your passion and that you are doing this for your to be well with yourself and to grow as a person and to give them a better future. And not only because of the money, it doesn't have this objective. It's to
our passion. Yes.
Exactly. And now, thankful, I have a daughter that understands that, and we managed to compensate. And she even likes to see the presentations. And she's very small, but still she likes to see what I'm doing and who I'm teaching, and does conversation with the doctor. So it's very nice. About the talk that you are talking today, I know that you are talking about lasers, but there are so many lasers, soft lasers, hard lasers, as we call it. So what type of laser we will talk about today?
So today I'm talking specifically about the Epic BioLase. It's what I have. I'm not sponsored in any way by BioLase, but I have purchased an Epic and also the Epic water laser. It's an erbium, a chromium, yttrium, scandium, gallium, and garnet. That's what it uses. But they call them erbium. So it's water. It uses water and air, so it keeps the tissue cooler. And then I'll go more in detail once I get into my slides.
Okay. And do you think the investment in a laser, that is also a big investment, is a way that you can then do marketing yourself as a laser dentist?
Absolutely. It's worth every penny because I feel like patients nowadays, at least the quality type of patients that you want to attract to your practice, they're the kind of patients that want to see your videos, they want to see patient testimonials, they want to see that you're investing in your education and also investing in purchasing these high-tech equipment, such as a laser. It's to me, it's made a huge difference. It added, because I don't want to be, just the bread and butter type of dentist where I'm doing fillings and crowns all day. Yeah. That's too boring. I'm sorry. It's too boring. It's too boring. I mean, I used to be a hygienist too, like a long time ago. And then I felt like, okay, I can't just do routine. I need challenge in my life. Does that make sense?
Yeah.
So surgery is like very challenging to me because every time I go in, it's like I'm exploring something new. Okay, I don't know what I'm going to run into, but I'm going to manage it. That's where it becomes so exciting, because at the end, when we accomplish something beautiful out of that, it's like we feel good. It's very gratifying because here I am, I've done something, I made a difference. This patient is now went from not smiling to completely having a beautiful, confident smile. With that, I think it's huge. It's like, to me, I can't, it makes me very happy.
And fulfilled, right? You feel that you are,
yes, exactly. Only dentists understand our passion. Like when we talk about this, when I talked about this with my family, they look at me like, Are you crazy? Like, who gets excited about teeth and surgery? Please, I don't want to hear what they say. I'm sorry.
Yeah.
Go ahead.
That's true.
Right.
And, how do you think lasers have been helpful in your practice? What kind of procedures you do, and what kind of more advantage you have having a laser in your practice?
So I have a lot of slides. I'll be showing you some of my cases, but mainly, why did I purchase it? Because I do a lot of cosmetic work, like veneer cases, and a lot of these patients also need crown lengthening because they have gummy smiles. At that time, we had wax up, only the traditional wax up, which is boring. You know, we have to take impressions and to the lab. The lab takes 2 weeks. Then we get a wax up. Then we have to design. I mean, at the time, I didn't even design a surgical stent for my crown lengthening. Now we do everything digital. So digital scanning, digital wax up, and then we design the smile based on the patient's lips and their face, and then we know exactly where the margins need to go. So nice. It's nice to have the laser because you don't have bleeding. So when you're doing crown lengthening procedures like that, there's hardly any bleeding, and you can score the bone with the laser. So it's perfect for what I do. So basically that's what I bought it for, and it was the best investment I've done. But I use it for it opened so many other doors for me, which I will share with you in my presentation.
Okay. And before you start your presentation, that we are very interested in hearing, I would like to ask you, how is the situation? Because I know it's quite difficult in the United States. Are you working at this moment? How is the situation about COVID-19?
Yes, we are working. We use, PPE. Everyone's not allowed to enter my practice without a mask. So everyone puts the mask, including all the patients. They walk in. They're allowed to take the mask off in the operatory, and then they have to put them back in. We have a system where they come in one door, they go out the next. It is difficult. It's really, I mean, we've had some patients test positive with COVID. We've had an assistant test positive with COVID. It's a struggle, right? Because then we have to follow CDC guidelines. Are we going to shut down? What do we do? It's really, I mean, it's a vicious cycle. I don't know if this is going to end anytime soon. Luckily and thankfully, I've been just steady and seeing patients normally. I'm still getting patients that want, aesthetic treatments, that want implants. So we've been seeing them. We've been staying open.
Yeah, that's good, because we are hearing the news, and the United States is quite complicated, the situation. I hope it will get better soon for everyone.
Yes.
And that
Arizona is number one right now in the world. So I live in Arizona.
Oh, okay.
It's number one. So
yeah, but at least you're able to work, of course, with all these protections and all this stuff and all these new protocols that everyone is doing now. But at least something is getting a little bit back to the normal.
Yes.
So, Dr. Hanna, the stage is yours. We are going to see your presentation. At the end, I will return again if someone has questions about not only the presentation or to Dr. Hanna. And at the end, we will talk a little bit more. Okay.
Thank you.
So,
thank you.
Welcome, and the stage is yours.
Thank you very much. So I know we started a little late today, but I'm gonna try and cover as much as I can, mostly slides, because those are the fun parts, right? So I'd like to share with you this quote on the next slide. It says, most people ignore opportunities because they only see danger. Visionaries ignore danger because they only see opportunities, by Simon Sinek. This is a good quote because to me, like investing in equipment or high-tech things, it's been paying me back. So don't be scared to invest. Don't think about where you're going to come up with the money. Just do it, okay? Because it's really going to help. All right. The next thing I want to talk about is what is laser stands for is light amplification by stimulated emission of radiation. And it was first postulated by Albert Einstein. Some of the benefits of lasers in dentistry is that when I use it, I have less or no hemorrhage. It's allowing me to do minimal invasive dentistry. So there is less need for sutures. I'll show you some beautiful cases that I've done. There's minimal post-op swelling. The patient responds. Usually there is no pain. They tell me they have no pain, no swelling, no bleeding, and they heal within like a week. So they're wowed by the fact that I use the laser. There's a lot of internal marketing, because if we make them happy and they're not in pain, then they refer other patients to us. We also use it for photobiomodulation, and it does that by decreasing inflammation and edema. I use it, it has like a special wand, the diode laser does, and I use it especially when I'm doing all-on-4 or all-on-X type of surgery. So I just run it around the jawline, and it helps to decrease in inflammation and swelling. It helps also to increase vascularity. It seals the blood vessels for better visibility, and so I can see better. It increases the cell metabolism and proliferation, it helps in increasing the fibroblast and the osteoblast. So therefore we have minimal post-op swelling. It also increases beta endorphin release and stimulates the formation of ATP. Therefore, it helps in cell regeneration. It also improves the immune system function. Some of the uses of the water laser can be hard or soft tissue. I'm going to discuss a little bit about the hard tissue. We can use it for cavity preparations, caries removal. If we want to do like micro etching of the teeth prior to cementing veneers, it's really wonderful to use. Enamelplasty, excavation of pits and fissures for placement of sealants. On Friday, I had a patient that had a lot of calculus, and he hasn't had a cleaning in a while. And I used my water laser because I felt really bad for my hygienist. I thought, oh my God, she has to take out the chisel and hammer to break this calculus off. So I just took my water laser off and I blasted the calculus off of the occlusal, the buccal, lingual. It was so tenacious, but it just completely cleaned that off, and it was beautiful to see. Some other clinical benefits are smooth cutting of the soft tissue and better hemostasis, because it has an increased pulse range of 100 pulses per second. There is no histamine release, so it leads to an improved, quicker post-operative outcome. We use it a lot for periodontal disease, the removal of calculus. Typically, if my patients have up to 6 millimeter pockets, I use a flapless approach. So my hygienist would do scaling and replaning, and then I use the water laser afterwards to remove any granulation tissue or any calculus. Anything above 6 millimeter, I typically like to flap the tissue. Again, using the water, I do a full thickness flap using the water laser. But my hygienist does the scaling and replaning first, and then I go back in and I flap the tissue, and I remove any type of granulation tissue remaining or calculus that she missed. Okay, so the water laser offers a very high yet safe cutting power without burning or charring the tissue, which is extremely important in healing. Better patient care is delivered without trading the efficiency because of the ability to use more power for a faster cutting effect. The water laser I Plus has 5 to 100 pulses per second. It's more intuitive, user-friendly, so it has a lot of over 60 programmable presets, and all you have to do is touch the button if you want to do laser crown lengthening, open flap, close flap. It has all these applications already set up into the laser. The high powers are to be utilized without anesthesia at times because of the thermal relaxation time that's increased between pulses. So with increased power, you have and the water and the air, it gives you again less pain and less swelling. It has a high illumination in the handpiece, and the trunk fiber is 4 times higher and more flexible, lighter. And more flexible than and can transfer the power to the handpiece more efficiently. So it cuts really fast and it makes it more reliable with less failures. We can use it for endodontic surgery, root amputation. We can do the flap preparation. I've been using my water laser anytime I have to do any type of flap. I use the water laser because there's less bleeding and, like I said, quicker healing and less pain. We can cut the window and cut the bone. We can do an apicoectomy. We can do the root end preparation, so you can use it to cut the apical part of the root and then just do retrofill. Any removal of pathological tissue like cysts, neoplasms, abscesses, hyperplastic tissue or granulation tissue in the apex. Sometimes you have a tooth that has chronic abscess and you go in to do an extraction. It's very hard to remove the granulation tissue all the way down in the apex. So it's wonderful to do that and disinfect the tooth at the same time. Next thing I'm going to talk about is a little bit about root canal. Also, it can be used in preparation of and obtaining the access to the root canal, enlarging the access hole. Also, sometimes like finding that mesial buccal canal on tooth number 14. It's also used to debride and clean the root canal, disinfect, and you could use it for pulpotomy on kids and pulpal extirpation. Bone and surgery, you could use it for osteoplasty and osseous recontouring, osteectomy, osseous crown lengthening, vestibuloplasty, osteotomy, implant recovery, and uncovering and implant removal. I had a patient last week that came in. It was number 19, and the placement of the implant was a little bit distal, so he broke off he broke off the crown, and there was a screw left only with nothing to unscrew. So those are like your nightmares. And on top of it, he had very dense type 1 bone, and there was bone all the way around the implant. So the reason I decided to remove it is because it was a little distal, and I believe the occlusal forces were done wrong because of the crown. So I decided to just remove the implant. So I measured the implant. I also measured the tip of my water laser, and I went around the implant gently and removed bone, and then I just took a forceps and unscrewed the implant, bone grafted. So it was perfect for that situation. And then hopefully later on in about 3 months, we can go back and place a new implant. Here are some pictures that I'm going to show you my cases. Tori removals before and after. My helper there is going a little bit too fast on my slides. Thank you. We couldn't get my presentation to start, so he's helping me. Anyway, this is huge to my practice, these tori removals, because now I am like the tori queen in the world. Patients come from all over to see me for tori removal. I started with one and now I love them. Again, it's because it's challenging and it's surgery. So I like doing these. And I ask my patients to leave me video testimonials afterwards. Believe it or not, they don't have pain, they don't have any issues, no bleeding. And so they come in, they gladly will leave me a 2-3 minute video testimonial on their experience. And in turn, that works for internal marketing, attracting other patients. This is one of my big tori removals that I've done. As you can see, like inside around the tori on the lingual, there's like some deep grooves. So I use the water laser to do my flap inside those grooves, and I just go above and just go in because the tip of the laser is like 0.5 millimeters, so it can really get in there, and I can just use it to flap completely instead of using a blade or a scalpel. And I feel like I can maneuver around better. So once that's released, I just expose the tori and remove it. I use piezotomes to do that. A piezo surgery. I'm sorry, not piezotome. This is another tori removal. Again, my incision was right above the tori. Here's another one. He's going a little bit too fast. And here is a smaller one. I think this one I made the incision intracellularly through the papilla and just reflected it and did some suturing. This one was a maxillary torus. Okay, we need to switch slides. One more. Sorry. He's controlling my slides for me. We couldn't download them. So anyway, this one was a maxillary removal. Again, this patient was a heavy smoker and just took forever to heal. So, and it was very, very challenging to remove this one because of the angulation. I was like, okay, how am I gonna get under the tori to remove it? So it was a combination on this one with piezos, as well, piezo tips, and also I used a little bit of a high speed and slow speed surgical unit to get it off. Here's a little animation video of implant uncovering. I don't know how much time I have, but let's watch this real quick. Okay, you can click on it so it can play. Go ahead and click on it, please. No, click inside the video. Can you go back and click on the video?
Anna, I think it's not possible because your
okay,
we'll see.
All right, technical difficulties here. Okay.
Pass on the videos.
Well, we have some pictures, so we'll fix that. I use it a lot also to, like I said, with making full thickness flap, partial thickness flap, or split thickness flap. Removing of granulation tissue from like bony defects. I use it a lot along with my hygienist to do soft tissue curettage. And anytime we have an abscess or necrotic soft tissue, I use it as well. Here's a picture of a simple crown lengthening before and after. This patient was referred to me by the orthodontist, and they wanted that gingival margin on 8 and 9 to be equal. So super easy. It took me 2 minutes. I went in, I removed like a little, I marked my tip of the laser. I did this flapless and removed the tissue, and I think we did like 1 millimeter of bone. bone removal, and this was immediately after that picture underneath. So you get beautiful results. Okay, another video we're not gonna, I guess we can open. Here we have, if we can flip through the, yeah, another one. Thank you. Yes. This has extremely been beneficial to me. Okay, removing crowns or veneers. Sometimes with the veneers, if I'm doing 6 to 10 veneers, a little movement, micro, like it could be half a millimeter. If I cement my veneer wrong, before I used to have to cut it and then take another impression and then send it back to the lab and then have the patients come back, we anesthetize. Now what I do is just basically I use the water laser to warm the cement, and I go around the margin and then just do some horizontal movements on the veneer. And then I just take a spoon or a scaler and pop it off and just remove the cement and re-cement it again. So it has saved me a lot. And I know most labs don't like it when we resend them for another veneer, because then they charge us for it. They're like, well, it's not my fault, you know, you put it on wrong. So this has saved us a lot of time and also pain for the patient. Soft tissue, if now I'm doing a lot of digital scanning of the crown preps instead of impressions. So you need to have nice margins. So we do gingival troughing for the crown impressions or the scanning to show the margins. Gingivectomy, gingivoplasty, incision and excision, reduction of gingival hypertrophy, or any type of discoloration or pigmentation. You can just go ahead and remove the outer surface. Very, very easy. I've also used it when I do my implant recovery, or where I'm doing like a buccal roll. I just de-epithelialize the portion that I want to tuck under, so I can thicken the gingival tissue on the buccal of the implant. So I've used that a lot. The next slide talks about soft tissue indication, including pulpal tissues. So like I said, I do a lot of incisional biopsies. Exposure of unerupted teeth, you could use it for fibroma removal. I get a lot of patients. I'll show you some cases. Flap preparation, frenectomies, a lot of frenectomies, hemostasis. If I have a spot that doesn't want to stop bleeding, I grab my water laser. Incision drainage of abscess, laser soft tissue curettage of post-extraction. This is huge because, like I said, sometimes we can't get down all the way to the apex. Operculectomy, exposing teeth and wisdom teeth. Removal of pathological tissues, any type of tissue. Very, very easy to use. And then I send it for a biopsy. And then treatment of canker sores and herpetic lesions. Usually what I do is use it at the dry setting. We call it Band-Aid setting. And then I just use it to scab the area. And typically they heal within like 2 to 3 days instead of weeks. The next slide is this little kiddo. Has a lingual frenum that's attached to his tongue. And he had some speech and other issues. So that's the same kiddo here. And then we went ahead and did a frenectomy, and this was the result. So his tongue was free, and then now I think he's seeing a speech pathologist. This was a little more challenging. As you can see, there was multiple. The next slide, please. Let's go back to the previous, or yeah, another slide. Let's flip. And another one. There we go. Okay, thank you. No, back. Back one. Perfect. Thank you. So this one had multiple frenums. It was a wider area. It was a little more challenging for me to do. but I still went ahead and did it. I think we gave him a release of about 10 millimeters. Okay. And then here's a big thick one. This one ended up also with a nice result. The next slide. Thank you. Perfect. And here's another patient, again with lingual frenectomy. And then on the next one, and the next one, the next one. So here we did both a labial, and I did a labial and a lingual frenectomy at the same time. And you can see huge difference there. He was able to elevate his tongue all the way to the palate and touch his palate. This one was the same patient. Next slide was the same patient, showing before and after. And these slides, the before, the after slides, are typically 2 weeks. I have them come in. The next slide is a video. Again, we're gonna skip it because we couldn't download my entire presentation. Here's another labial frenum that's attached. Okay, so these, typically patients have a lot of recession with these. So I tell them, you know, let me go ahead and remove the frenum so it doesn't keep causing you to have recession. And then here is the next slide would be the 2 weeks after. And then the following slide was a patient that was referred to me by a orthodontist. He was 22, and his orthodontist wanted me to do a labial frenectomy so he can start braces, and so he won't have relapse on the diastema there between 8 and 9. So I went ahead and did that. And this was the slide on the far right was about also 2 weeks after. The following one is another video, so we'll skip that. Okay, and then we have some infant frenectomies. So these little kiddos, beautiful babies. I hate to do these because I hate to inflict pain no matter what. They do have pain and they cry. So we ask their parents to stay in the waiting room. We swaddle them and we put special infant laser glasses on them. Typically, my assistant will hold the baby or the infant, and then the other assistant will hold the head, and then I work. So it's a little bit challenging, but they can't latch on to the mother's breast for feeding. So I look at it that I'm helping someone, you know, breastfeed. So it's worth it. But typically, you know, it's hard to hear these little infants cry. We do anesthetize a little bit, and we get it done in like 5 minutes typically. This is a patient that came into me to our office last week, and what happened is he looked like the far upper left. He had a fibroma developing there on his lip, or at least I didn't know what it was, but it looked like a fibroma. And I thought, okay, what happened? He said, well, he was in a car accident and he went to the emergency room and they put stitches, and then he developed a scar, and then he started biting his lip. So his mom, poor mom, drove 4 hours to come see me, and I took it off, and the upper right slide is immediately after I took it off. And then the bottom one was 2 weeks post-op. I was not super happy with the 2 weeks post-op, so I did go back in and felt, you know, more that I felt like I needed to remove more. Again, just because I want to remove more scar tissue. I think he's gonna heal wonderfully. I haven't seen him yet. His post-op is scheduled next week. But again, like, this doesn't need suturing. This is why he developed a scar to begin with. With the laser, there's no suturing. You just do Band-Aid setting and it stops the bleeding immediately. Here's another fibroma that next slide is, again, patient was biting the lip. And the funny thing is, when they come in, sometimes they don't even know we can remove these. They think it's normal. They don't even know that this is abnormal. So we pointed out and we're like, hey, you want this removed? It takes 5 minutes. And they're like, sure. So then this is immediately after I took it off. Next slide. Yeah, cool. And then this is, I think this was like a week post-op, but they heal beautifully and they don't have any pain, and I don't ever have to do any stitching. Okay, and then the next is another video that we can't watch, unfortunately. And so the next slide would be, how do you grow your practice? Raquel asked me, what do you do now with COVID? How do you get patients? Well, you always have to, like I said, invest in yourself and your education. Find your passion. What makes you happy? What makes your heart happy? Is it surgery? Is it lasers? Is it what? For me, anything that gives me a challenge makes me happy. So I invest in my surgical knowledge, especially implants and lasers are my passion, and aesthetics, because when I make a patient happy and smiling, I want them for life, and it's the most gratifying thing for me. So invest in yourself and your new technology. Connect to your patients on an emotional level. Truly care about them, and just show them that you love them and you care about them as if they were your own family. Don't do it if it's just for the money, because the money will come. Increase your number of new patients, because when you do good work and you're knowledgeable and patients see your reviews, and they also see your video testimonials from other patients, they will automatically be drawn to you. They will come to you, and they will ask you to do the procedures on them. You don't even have to work hard on closing the treatment case. They will just, that's why they're there. So it makes life a lot easier. Increase your capacity to do more dentistry by more continuing education. So be a continuing education junkie like me. You must create systems and checklists also for your team and for everything you do in your practice. This is how you're going to help your team grow, invest in their education and their learning. And in turn, they will be more confident in how they explain treatment to the patients, and they will sell you your treatment, and you will in turn make more money. Do non-stop marketing, including Facebook and Instagram. I do a lot of that, and also Google ads, so don't ever stop doing marketing. Increase your team efficiency. We do weekly and monthly meetings where I buy my team lunch, and we just sit down and talk about new ideas and what we can do to improve the practice. I make them feel like they're partners with me, but I also invest in their education so that they're well aware of my vision also and what I believe in. And they help me, because I can't just do it by myself. So I need a solid, successful team to help me. Also, at the end, when they help you, you have to reward them. Somehow find out what makes them happy, and then do it. The next slide is our course that we're putting here together in Phoenix. I'm partnering with Elaine Rodriguez, and we're doing some laser hands-on courses. If you want to learn how to do a tori removal, how to use the flap, how to use the water laser, how to use the Epic diode, the Epic diode laser as well, with your hygienist. We daily use lasers in my practice. My hygienist uses the laser almost on every patient. So I have her laser certified, and we believe in the use of lasers in my practice. So if anyone's interested, email Elaine. I'm going to leave the slide up, and just put my code for a special discount. #Hanna. Thanks, Elaine. And then that's pretty much it. Raquel, do you have any other questions for me, my dear?
Thank you so much for doing this presentation in a strong situation, because I know that you couldn't upload your keynote presentation. So this happens.
Too bad. I know. It's okay.
Doing live webinars, and everything happens. I can tell you that my first webinar, when I was doing COVID, my daughter was doing toasts, and the light went down, and I lost everything, and I was talking to the computer, hoping that I was talking to the audience, but I was not.
Oh my goodness.
I know that sometimes things happen. I think better than that is the way that we contour the problems, and we managed to do it. So thank you, Anshul, for passing the slides of Dr. Hanna. And sorry for not having your
Thank
video.
You so much.
Could be more enlightening, but I think it was very well explained, because people were very satisfied with a lot of good comments. And let me see, we have here a question. Can we stud laser or use laser directly after bachelor dentistry, BDS? So I think it's what we call the general dentistry. I think so. You can, of course,
Can they use it like for like general dentistry? Absolutely. You know, little things. You can do class 5 composites. I think, you know, for anyone to start, you don't have to be surgically trained to do it. It's extremely easy. I really feel sad that I couldn't show you the animated videos, but it's so easy. Like with the fibroma, you just take a cotton plier or a tissue forceps and you hold it and you just remove it, and it stops bleeding. You can just use the Band-Aid setting. Of course, you have to get training, which is why I put my course up there. We are training in depth how to use the lasers. There is a lot of training, a lot of organizing. You have to train the team. It's a very expensive piece of equipment, so you don't want people to drop it and break it. But there's a lot of things you can start. Absolutely. That, I mean, I wasn't born to know all the surgery and to do all these things, but I had to take a lot of continuing education. So don't stop.
Yeah, totally agree. And you think it's more useful for you for soft tissue or for hard tissue, or for both?
Is it more useful? I would say more soft tissue uses is most useful. Hard tissue with the tori removal, I would not use it because it's type 1 bone. Usually it's extremely dense, that bone. Sometimes I go to the piezo, and if my hand gets tired, I switch to the hand piece in between to the high speed. But it's pretty challenging with bone. I think for crown lengthening, however, if you want to do bone removal, it's wonderful to use. There are special tips that you can score the bone and remove it. So it just depends.
Someone is asking if the training that you gives a certification or a kind of a mastership or master degree. What kind of course are you giving? If it's short courses or long courses?
So the course we have offering right now, September 25th and 26th, is a day and a half. The first day it's more lecture. And then the second day is all hands-on. So it will be in my practice, and I have a conference room. They will have 12 continuing education hours through AGD, which is the American General, what is it called? AGD is the American General Association. Yes. So I don't know if that's something that they can utilize anywhere else in the world, but for us in the US, we can use it. Yes.
Yeah, that's a number of hours of continuous education, right?
Yes. Yes.
Yeah.
But we don't have a master's certification. I believe BioLace, the company, offers that. I have to look into it and check. Yes. Again, I wasn't like sponsored by them or anything, but any laser will do. You just have to do your due diligence and do your research on which one would work for you. I've had this one for 7 years, and I'm super happy with it.
Mm-hmm. Yes, of course, it depends on the brand of the laser. You have to study all the protocols and know how to work with this, because it's a very expensive instrument. And of course, you have to have some education even to know protocols to use in each situation. But of course, I know there in some countries there are some master degrees even in laser therapy. I don't know in the United States. But like long programs about only laser therapy, all the applications, not only the surgical lasers, but also the soft lasers for biostimulation and for antibiotic photodynamic therapy. And they cover all the aspects of the laser, not only the hard lasers, but also the soft lasers. By the way, you have any experience using other types of laser, or you are using only this kind of laser?
This one, I've had mostly this one, and then one prior to that, it was a diode laser. I think they closed out of business. But yeah, just mostly this. I'm just developing my courses. I'm putting those together with my partner, Elaine. So we're starting with lasers, and then next we will be doing some things on surgery, bone grafting, and like just beginner, how to bone graft, how to place a membrane, and just educating the dentists out there, like what type of membrane should I use and when, and basically the different types of suturing. So that would be like things for the beginner, and then hopefully advanced courses later on.
Yeah, and I think the same doctor is asking, where did you study lasers? If you studied in the United States, or you went from other country to do your education?
I've only done lasers in the United States. I've done most of my education through BioLace, but they have independent doctors that teach lasers. I'm constantly taking continuing education with them. Again, I enjoy doing lasers. My top priority, however, is surgery. So I invest more of my continuing education on surgery, because I feel like if I'm confident doing surgery, laser is just going to be like a toy in my practice.
Exactly. It's like when you're good doing like freehand surgery, you can do guided surgery. If you don't know how to do freehanded, it's kind of complicated, because sometimes you can't deal with the problems and with the complications. That's why it's very important to know how to work first very well with all the
and you have to learn.
And then you can upgrade with all this new technology, but first you have to deal with the basics.
You have to learn how to close a flap. You have to learn how to suture. You have to learn how to handle bleeding if it happens. With these tori removals, these are huge. Sometimes they go all the way down to the bottom of the jaw. So you have to understand, how do you handle these? So surgery, if you're going to jump into doing these things, you have to know how to handle bleeding and flaps and closure and all that.
Yeah, all the basic principles, and then you can play with the big toys.
Exactly.
And also see the great message that you are receiving on Facebook. A lot of people congratulating you on the wonderful presentation.
Thank you.
And
thank you for listening.
Explaining all these details. Thanks for your time and for your availability in a Sunday to be here with us to collaborate in this webinar. We are trying to reach the maximum of peers of doctors possible, because we know that in some countries they can't afford to pay this expensive education, and now with this situation of COVID-19 we can't travel, so we are trying to maintain all the class updated in these new hot topics. So thank you for bringing us about the laser, and I hope we can see again presentially soon. I hope that the things about COVID in the United States start to calm down a little bit, and that everyone will start to do presential education, and step by step. Of course, it will take time, but I hope we can meet soon. And saying goodbye from Portugal, directed to USA and to the world. Thank you so much for your time and your goodwill to teach us about this topic. Okay.
Thank you so much for your time as well, Raquel. I appreciate it. And hopefully we'll see each other soon.
Yeah. Thank you. Bye-bye. Thank you.